Hello, I'm Natalie Graves Tucker, and on behalf of AARP, I want to welcome you and thank you for joining us. Today, we are going to take a deep dive into what's ahead for Medicare in 2026. But before we begin, if you would like to listen to this program in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y cero en su teléfono ahora.
Today, we will cover a variety of topics on what to expect from Medicare in 2026, from cost and prescription drug changes to the status of telehealth. We will discuss the changes aimed at making coverage more affordable and accessible for beneficiaries like you. We're connecting with thousands of AARP members from across the nation, and we'll be joined shortly by thought leaders who will take your questions live. AARP, a nonprofit, nonpartisan organization with a membership, has been working to promote the health and well-being for older Americans for more than 60 years. And we are in your corner, fighting on issues that matter to you and your family. If you participated in one of our tele-town halls before, you know this is similar to a radio talk show where you have the opportunity to ask questions and get answers from our guests. So for those of you joining us by the phone, if you would like to ask a Medicare-related question, press *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you're joining on Facebook, you can post your question in the comments. Hello. If you're just joining, I'm Natalie Graves Tucker, and on behalf of AARP, I want to welcome you to this important Medicare discussion, Medicare 2026, Key Changes and Savings Strategies. Thank you for joining us today and participating in this tele-town hall. To ask your question, please press *3, and if you're joining on Facebook, you can post your question in the comments. Listeners, we will be sharing cost information and resources with you today, so you may want to grab a pen and paper to have handy. Let's get started. I'll be joined by two guests who can help us navigate everything from drug price negotiations to new cost protections and the latest developments in Medicare Advantage. Andrew Scholnick, Government Affairs Director for AARP, and Xavier Vaughn, Senior Advisor, Medicare Programs, AARP. Andrew and Xavier, I'm so happy to have you both with us today.
Happy to be here.
People enrolled in Medicare, the federal health insurance program for individuals ages 65 and older, and some younger people with long-term disabilities, choose to receive benefits either through traditional Medicare, also called Original Medicare, or through a private health plan that contracts with Medicare, called Medicare Advantage. So let's start with a quick refresher to remind listeners about the differences between Original Medicare and Medicare Advantage. So Xavier, can you get us started?
Absolutely. Original Medicare will be your both Part A and Part B. Part A will be your hospital insurance, and so that will deal with inpatient hospital care, some hospice and home health care, and some skilled nursing facility care. And do not get skilled nursing facility care confused with nursing home. That is more your rehab after an accident type of situation. And then also your Part B, that will be your medical. So think about going to your primary care. This will be your preventive services and some durable medical equipment like a wheelchair or walker. It is possible to add Part D and a Medigap plan to Original Medicare. Both Medicare Part D and Medigaps are sold by private insurance companies, and Medicare Part D covers prescription drugs, so think D for drugs. And Medigap, as the name suggests, is a supplemental insurance policy that helps fills in the gaps that Original Medicare may not cover. And for Original Medicare, enrollees sold by private insurance companies but are regulated by state and federal government. Next, we have Medicare Advantage. You also may hear it referred to as Part C in the private insurance companies, and they're also federally regulated. These are what you're going to see all the commercials for on TV. You're going to see JJ from Good Times on some of the commercials. And what they do is they combine Part A and Part B, and most of the time Part D, into one comprehensive plan. And they're going to feel very familiar to people. They're going to feel like your employer-sponsored health care. So you're going to have your HMOs, your PPOs, have to deal with in and out network and out-of-pocket max. And a Medicare Advantage plan has to cover everything that Original Medicare cover, but they may have additional benefits. Original Medicare, unlike Medicare Advantage plan, has no network, so you can be used nationwide. There are pros and cons to each, such as additional benefits and limited provider network. With with Medicare Advantage plan, with Original Medicare, you can have that Medigap plan that can cover quite a bit, and also have no network. So it just really has to think about what people's financial situation is and what their medical health history to determine which is the best avenue to go with.
Well, thank you for that refresher. I think I have it. Original Medicare is called Parts A and B, and you can add a Part D plan to Original Medicare for prescription insurance, or add a Medigap plan to cover some out-of-pocket costs. And Part C is called Medicare Advantage, and that's a private insurance plan you can buy to replace Original Medicare.
You got it.
Sounds great. So let's talk about cost, which is often a top concern for beneficiaries. We can't talk about the cost without mentioning the Inflation Reduction Act. The Inflation Reduction Act grew out of years of advocacy to make medications more affordable for older adults, and AARP played a big part in getting it across the finish line. From longstanding efforts to push for fair drug prices, AARP and its members helped ensure that millions of people have finally seen some real relief at the pharmacy counter. And we see continued rollouts of major changes that affect everything from insulin prices to out-of-pocket caps. Andrew, starting with you, how does the Inflation Reduction Act impact Medicare in 2026?
Sure. Well, most importantly, it impacts drug prices. Now, again, this bill was signed into law several years ago in 2022, but its impact is just now starting to be felt. And 2026 is a huge year because this is the first year that Medicare will be able to negotiate prescription drug prices, and those drug prices are now in effect. In 2026, 10 drugs will now have their price negotiated by Medicare, and those 10 drugs are used by nearly 9 million Medicare Part D enrollees. And we're already seeing that Medicare drug price negotiation is doing exactly what we thought it would, which is getting lower prices than what individual Part D plans were getting previously. Because we're using the entire purchasing power of all about 70 million Medicare beneficiaries to negotiate for better prices. And according to the Centers for Medicare and Medicaid Services, that translates into about $1.5 billion in out-of-pocket savings for enrollees this year. And those savings will grow as more drugs are negotiated over time. We also know that people are seeing reductions in what they have to pay at the pharmacy. Research is already showing us that out-of-pocket costs will drop by an average of 50% for the negotiated drugs on people's prescription drug plans. Again, AARP fought for decades to give Medicare this power to negotiate, and we helped win passage of the law in 2022 and continue to defend it so it's fully implemented. Some other impacts that have been implemented and are still in effect are an out-of-pocket cap on prescription drug costs. That continues this year. Last year was the first year that this out-of-pocket cap in Part D was in effect. And there's also a monthly limit on insulin purchases at $35. So if you're a diabetic and need insulin, the out-of-pocket limit each month is $35. Now, this is historic progress, but AARP will continue to keep pushing until every older American can afford the medicines they need.
Thank you for laying that all out there for us. Now, I know Andrew just touched on the cost of insulin, but capping the cost of insulin was such big news last year. Can you remind our audience about how beneficiaries benefit from this?
Yes, so there is a $35 monthly cap that applies to insulin both under Part D and Part B, and there's no deductible for insulin under Part B. Under Part D, and helps manage diabetes care affordably. But it is also really important to note that not every insurance company is going to cover every single insulin. So it's really important to make sure that the insulin that you're on is still covered by your insurance plan. And if not, then have a conversation with your provider to see if the insulin that is covered underneath your plan would be a good fit for you.
And what will beneficiaries need to expect regarding the Part D out-of-pocket cap and deductibles for 2026? Andrew?
Sure. Well, that cap on out-of-pocket costs I mentioned for 2026 is at $2,100. It's up slightly from last year, which was a flat $2,000. And this cap means that once you've spent that amount of money out of pocket for prescription drugs, you won't have to spend any more. and this applies to all Part D plans. And the intent is to protect beneficiaries from catastrophic drug costs. Now, there's still a deductible in Part D, which was adjusted again this year, so it's about $615 is the maximum. Some Part D plans will have lower deductibles or maybe even none at all. But the deductible is the amount that you pay first before your insurance kicks in. But that amount does count towards the out-of-pocket cap. So after that, once you start paying copays and coinsurance and prescription drugs, you hit $2,100 for the year, and the out-of-pocket cost is negligible after that.
So all very important information for beneficiaries to be aware of. So thank you, Andrew and Xavier. I want to turn to you to discuss Part A and Part B of Original Medicare. While we know most individuals pay no premium for Medicare Part A of Original Medicare, what can beneficiaries expect to pay for Part B in 2026? Xavier?
Yes, so just as Andrew was saying that there was a slight increase, there's also a slight increase with Part B premium. And so for this current year, the premium is $202.90, which is a slight increase from $185 from last year. And if you are someone with a higher income, if you're for individuals, that'd be $109,000. For a couple, $218,000. Then you may have to pay slightly higher for your Part B premium. This is called IRMA, or Income-Related Monthly Adjustment Amounts. And also, there is a deductible of $283, which is a slight increase from $257 from last year.
Great information, as we often get questions about the cost of Medicare. Andrew, considering that your income affects what you'll pay in monthly premiums for Medicare, can you speak to how your income or any changes to your income can affect your premiums?
Yeah, absolutely. I know this can get confusing for some people. So again, there's several components of Medicare. Again, it's Part A, which is your hospital insurance and covers your inpatient stays. Part B, which covers your outpatient or care, or every time you visit the doctor's office. And there's Part D, which is your optional prescription drug coverage. So in Part A, most people don't pay monthly premiums. If you or your spouse has Medicare or had your Medicare taxes deducted from your paycheck for 40 quarters of work, which is the equivalent of about 10 years, and you're eligible for premium-free Part A coverage. So for Part A, most people don't pay monthly premiums. However, for Part B and Part D, there is a monthly premium. And the federal government subsidizes Medicare premiums quite a bit. In fact, they tend to subsidize at about 75% of the total cost. But the more you earn, the less subsidy you receive. So if you're over a certain amount, you'll have to pay higher Medicare premiums. Medicare premiums are based on what's called your modified adjusted gross income. Sometimes people call it the MAGI or MAGI, which is your total adjusted gross income plus any tax-exempt interest you may have earned over the course of the tax year. Now, to calculate it, Medicare and the Social Security Administration look at your most recent full tax filing. So in 2026, for your benefit year this year, the most recent tax filing they have is from 2024. So they look 2 years basically into the past at what your income was to judge your premiums for now. And that can cause confusion for some people, and there are ways to appeal that decision if you feel you shouldn't be paying higher income premiums.
Now, this is good to know. Xavier, do you have anything to add?
Yes, so keep in mind that if your income changes this year, it could affect your Medicare premium for 2 years into the future. For example, let's say 1 year you sold a property or cashed in a retirement account, and that caused a 1 year spike in your income for that year. 2 years later, you would have to pay a higher Medicare premiums, but then in 3 years, your premium would go back to where it would typically stay unless something like that happens again.
And who can I go to if I have any concerns about how my income was calculated?
Yes, you can contact the Social Security Administration to make those adjustments. If you need any assistance, you can also reach out to your state health insurance assistance program, also called SHIP, and you can reach out to them at shiphelp.org to find your state's SHIP office, where a representative can help you make an informed decision about your benefits.
Thank you both for explaining that in such detail. Now, just to confirm, could this impact your Part D drug coverage premium as well, Xavier?
Your Part D premium will change depending on the plan that you join. There is no standard premium for Part D plans like there is for Part B. But as mentioned, if your income meets or exceeds the higher income threshold, IRMA, you'll have to pay more for your Part D premium as well.
Got it. Thank you. Listeners, a quick reminder, we'll be answering your Medicare questions shortly. To ask your question, please press *3, and if you're joining on Facebook, you can post your question in the comments. I have to say, this information has me wondering about the impact of income on Medicare Part C, Medicare Advantage. Xavier, can you shed some light on that?
So private insurance companies offer these plans, which bundle the services that are covered in Part A, Part B, and usually into Part D into one plan. You still have to pay the cost for Part B premium if you buy one of these plans. So with that being said, you would still have to pay that higher premium if you meet the higher income threshold. Some Medicare Advantage plans charge an additional premium that goes to the insurance company that administers the plan. This additional premium will not change based on your income. If you need assistance, once again, you can reach out to shiphelp.org, your local state health insurance assistance program, where our representatives can help you make informed decisions about your benefits.
Thanks, Xavier. We have a lot more content to cover. But first, listeners, let's get to some of your questions about Medicare. To ask your question, just press *3. I'd now like to bring in Julio Rios Viena to help facilitate your calls. Welcome, Julio.
Hi, Natalie. Happy to be here.
Julio, let's take our first question.
Our first question is Cynthia calling from New Jersey.
Hi, Cynthia. What is your question?
I was wondering, I have traditional Medicare A and B, and I'm receiving knee shots, not cortisone, but the gel shots, and I am being charged the deductible of $283 this year for 2026. And I was wondering if there are any services where that 2026 $283 deductible does not apply.
Thank you for that question out there in New Jersey. Xavier?
Yes, so in order to, you will have to pay the deductible for Part B, unless you have an old supplement plan that was available, Plan F, which the Part B deductible was covered through that, but no new individual can be enrolled into that plan. Otherwise, all the supplemental or Medigap plans, also you would have to pay that $280 some deductible.
All right, Julio, do we have another one?
Yes, our next question comes from Facebook, and Ronan asks, my 90-year-old father has Medicare Part A and B. He had a supplemental policy but lost it when they sent the premium notice to the wrong address. Is there an option during open enrollment for him to get it back without risking being turned down, or a way to take advantage by switching to Medicare Advantage?
Thank you for that question, Ronan, on Facebook. Andrew, can you help him?
Sure, that is a tough situation. During open enrollment at the end of the year, which is every year from October 15th to December 7th, October 7th to December 15th, he does have the opportunity to switch to Medicare Advantage if he wants, which would kind of package it all together. It is very difficult to get a Medigap or supplemental policy back once you've kind of given it up. But it sounds like in this case there were extenuating circumstances and they dropped the coverage because lack of payment for the premium, even though he never got the bill for it. So I think it might be, if he likes the Medigap supplemental, it might be worth trying to contact the insurance company and explain the situation. And if that doesn't work, perhaps again reach out to the State Health Insurance Assistance Program, or there's another great organization called the Medicare Rights Center that can do some personal advocacy on people's behalf. But if they don't give it back, then a Medicare Advantage plan is a possibility during open enrollment.
All right. Thank you for that. Let's go back to the line. Who do we have next?
Yep, our next question also comes from Facebook, and Marcus asks, are there tools that estimate my total yearly Medicare costs?
Xavier?
Yes, so I would point you to Medicare.gov, and once you're on Medicare.gov, create an account, and when you create an account, you can If you're new to Medicare, you can enter in all your medications, or if you're already on Medicare, your medication should pre-populate. With that being said, please review the medication. Make sure the frequency that you get it, the dosage, and everything is correct. And from there, you can select if you are on a Medicare Advantage plan or if you are on a Part D plan, and you can kind of see what the cost will be for the year. So it will take into account the premium. It will also take in account the cost of your medication. With that being said, if you get a total cost, you will have to add in your monthly Part B premium, but it will give you a good snapshot of at least what your medication plus that premium will be for the year.
Do we have another one?
Yes, our next question also comes from Facebook, and Elena asks, if my drug costs spike mid-year, are there programs that can help immediately?
Thanks, Elena in Facebook land. Andrew?
That's a good question. Yes, there are some, but actually one of the most important ones that, again, was implemented last year is that total out-of-pocket cap for prescription drug costs. So in addition to that, there's a cap at $2,100 for this year. There's also a program where you can spread that cost out over the course of the year. So if you hit that amount, like right now up front, because you have some high-cost drugs that you have to get every month, and you get a bill at the pharmacy for $2,000, you can elect to spread that amount over the course of the next several months, over the rest of the year, and pay in increments, which does help defray the costs over time. Now, that's for the cost sharing of the drug. If you're having difficulty with premiums for the prescription drug plan, your Part D plan, there is a program called Extra Help that some people are eligible for based on income, and that can help you pay the monthly premium, but that's slightly different than the out-of-pocket cost.
Thank you. Another one?
Yep, our next question, Naomi from Facebook asks, can I use mail order to lower my drug costs?
Xavier?
So I would also point you towards the Medicare.gov website where you can check the cost of your medication. And when you do that, you can also select the pharmacy that you want to use. So you can select if there's a local pharmacy that you like to use, but you can also select mail order. And then that way you can see if it actually will be lower cost for you and your medication. At that time, if it does come up that it is a lower cost, then you can go ahead and enroll into that.
All right.
Yep, our next question is Laura from New York.
Hi, Laura, out there in New York. What is your question?
Hi, good morning. I have two questions, two parts, if you don't mind. If you are currently on Medicare and the year after you decide to switch to Medicare Advantage, are you allowed to go back to Medicare the year after that?
And then you had another question?
Well, it's very simple. Are you allowed to get Medigap coverage if you're on Medicare Advantage?
Thank you for your two-part question. Xavier?
Yes, so you, during open enrollment, which Andrew mentioned earlier, which is October 15th through December 7th, you can go back and forth every year if you would want to between the Medicare Advantage plan and original Medicare. I wouldn't suggest that just for continuation of care, but you can. So during that time, if you're on original Medicare, you can go and make that change to a Medicare Advantage plan, and you can do the opposite. If you're already on a Medicare Advantage plan, you can go back to original Medicare. And with that being said, if you were to do that and you want to go get a Medigap plan, it may be difficult. If it's your first year, you do have a 1-year period where you can kind of, if you're enrolled into a Medicare Advantage plan, and this is really when you first are enrolled into Medicare, or if you already had a Medigap plan, they give you like a 1 year to see if you like a Medicare Advantage plan, and then you can go back to a Medigap plan without them looking at your health history or going through underwriting. But at a later point in time, if you would like, if you're thinking about a Medigap plan, then they will look at your health history and determine if you can A, enroll in that plan, and B, if they allow you to enroll in that plan, you may have to pay a higher monthly premium. There are some state, as I mentioned earlier, Medigap is regulated at both the federal and state level. So there are some state-specific rules. They may work in your favor, and once you get in, For example, in Missouri, once you sign up, you can change your plan every year around your anniversary period when you sign up for your Medigap plan. So that would allow you to be in that plan. You may have to pay a higher premium that first year, but then that second year, you shop around again and go to something with a lower premium. So there may be state-specific rules out there that can help you even if you have to go through the underwriting.
Another one?
Yes, our next caller on the line is Virginia, calling from Texas.
Hi. Yes, my name is. I'm looking to. I won't be on Medicare until this coming November, and here in Texas, they've come. I think we're like one of those new test states where you have to have pre-authorization and different new things. I think there's like 6 states. They said we're supposed to go for 2026, and it was kind of a big thing with people talking about it. And I was just wondering how that's been going so far. And as of now, I am on TRICARE, and which I will get off of, and then have TRICARE for life. So I'm just wondering, does it work kind of the same way as TRICARE with the pre-authorizations for certain things? And I know I have to get on Medicare A and B automatically, and then TRICARE for life. But I'm just wondering how that is different than, say, we have friends in Virginia who aren't in that the test state. Is what I was wondering.
Thank you for that question, Andrew.
That's a great question. So you're referring to a new program that Medicare started this year, and it's a pilot program or demonstration. It means they're, like you said, just testing it in 6 states to see how it goes. It's called the WISER program, WISER, and it's meant to reduce waste and fraud in the system. Now, the program itself is for a very specific, limited set of services. There's only 15 to 17 services that are subject to the prior authorization in this model. So I don't want you to think that everything you go to a doctor for, you're going to need to get approved by an insurance company or Medicare. That's not the case. It's for a very specific set of services. But those services do impact people that need them. We're actually kind of concerned about this program, and AARP has written a letter and lobbied on beneficiaries' behalf about this program for 2 reasons. One is the notion of prior authorization in traditional Medicare. And this is the concept of, for certain services that might be riskier or might be subject to fraudulent billing, the insurance company provides oversight and has to approve you getting the service before the doctor can administer it. We think that tends to add a burden to Medicare beneficiaries and patients and is an unnecessary step. We shouldn't try to insert more bureaucracy between patients and their care. The second aspect of it is that in this particular model, they are building an artificial intelligence or AI system to kind of do the determination. And we have concerns just about how that's being implemented and how that's operating. So it is a brand new system. We're hearing some anecdotes from people across the country and the other states. If you know anybody that this has impacted, feel free to send AARP an email or reach out to us because we're building stories. But yes, it is definitely a thing that we're monitoring for the impact, but it will not affect everybody or every service. It's a very select sliver of healthcare services that this is being applied to. Now, the second part of your question about TRICARE, I'm sorry, did you want to add something?
Go, keep going.
Okay. About TRICARE, you can keep TRICARE for life, and that will act as your secondary payer in most circumstances. So once you sign up for Medicare, Medicare will be the primary payer, and then TRICARE for life will kind of act as that supplemental policy to pay any additional stuff that maybe TRICARE offers that Medicare doesn't, or perhaps it offers like a better prescription drug package, I think they offer, rather than a Part D plan, or coverage for out-of-pocket costs and expenses. So it usually acts as like a secondary payer after Medicare pays.
Thank you both to Andrew and Xavier for answering our callers' questions. We will get back to the phone lines in just a moment. Andrew, I know we just spoke in detail about the cost of Medicare, but before we move on, is there anything you can share with people who are having financial concerns about paying for Medicare?
Absolutely. I know affordability is an issue that's on everybody's mind right now, and there are several programs that can help people afford health care. Most of them are called the Medicare Savings Programs, or MSPs for short. And these are state-administered assistance programs designed to help people with limited income and resources. And they cover Medicare-related costs such as premiums, deductibles, copays, and coinsurance. And they also can offer automatic enrollment in the Extra Help program I mentioned, which is for prescription drug costs. Now, eligibility does vary by state, but it generally includes some sort of income or asset threshold or limit. But enrollment is free and it won't affect your existing Medicare coverage. So if you think you might be eligible or just have questions about it, you should definitely reach out to your state Medicaid office or the state health insurance assistance program because they'll have information about how you can enroll.
And Xavier, do you have something to add?
Yes. So if your income has gone down, you don't have to wait for open enrollment to make any kind of adjustment or apply for the assistance program. So you can contact the Social Security Administration to make adjustments and contact your state Medicaid office to see if you're eligible or to receive help paying for premium and other out-of-pocket costs. If you need assistance with these applications, once again, reach out to your state health insurance assistance program and they can help you with those applications.
Thank you both so much. These changes really do shift the financial outlook for millions of people, and it's great to know that there's help out there if it's needed. Listeners, I know you continue to have questions, and to ask a question, just press *3 on your telephone keypad. If you're listening to us on Facebook, you can ask your question in the comments. We've touched on the Inflation Reduction Act and updates to the cost of original Medicare, but the new year also brings a new round of Medicare coverage and policy changes that affect each beneficiary differently, depending on their medical needs, income, and other factors. So we'll dig deeper into each, but Xavier, what are the biggest Medicare changes coming in 2026?
Yes, and Andrew kind of highlighted some of these things earlier. And so one of the biggest is that there's lower negotiated prices for 10 high-cost prescription drugs because we know that medications and the prescriptions are a big barrier for older adults, and some of them are outrageous in what they cost. So the top 10 have now been lowered, and this is something that will continue into years to come. So it won't just be the one-year thing. They're continually to look at other high-cost medications to do this type of work. Also, if you were enrolled into the Medicare prescription payment plan last year, you're automatically enrolled into that plan this year. And so that's really great for that way you don't have to worry about doing that same application or going through that process again. You can still, you're automatically enrolled. And for those who are just hearing for it for the first time, don't feel like it's too late. You can still enroll into that plan now. And there also have been some adjustments to some Medicare Advantage plans, kind of highlighting what Andrew was talking about, some of the testing that's being done. And so all of these are some of the big changes for 2026.
Thanks for that, Xavier. Now, I want to talk about telehealth for a minute. I understand we have a bit of breaking news about telehealth for Medicare beneficiaries.
Yes, the good news is that telehealth will continue. And so Medicare expanded telehealth coverage, originally set to expire, now has been extended through the end of 2027. And this allowed many beneficiaries to keep accessing care from home without needing in-person visits.
This is great news, but also a huge sigh of relief for so many, don't you think?
Yes, that is correct, Natalie. It's really convenient for those who are homebound or disabled or those with mobility or transportation challenges. Especially helpful for older adults living in rural areas who don't have access to Medicare care that is close by, and it also reduces exposure to illnesses. Also, it will improve management of chronic conditions to help many by offering more consistent follow-up and monitoring.
So all important things that we don't always consider. Andrew, I understand this extension even happening was a bit of a team effort.
Yeah, this is something that we've been working on for years, and AARP has been very involved in trying to actually make Medicare telehealth coverage permanent. Right now, it's been extended for 2 years, which is still a pretty huge deal. 2 years is a long time here in Congress in Washington. And I don't know if people remember at the end of last year during the government shutdown, one of the things that expired in October was that coverage for Medicare telehealth. The law that allowed Medicare to cover telehealth coverage actually expired on a certain date, and they had to extend it. And they didn't get around to extending it until this past February. So it's a really big deal, and we don't have to worry about an extension now for 2 more years. And this was a team effort. There's a lot of people here at AARP that's been focused on the issue, as well as hundreds of organizations here in Washington and across the country that recognize how important telehealth is to making sure people have access to care, make it easier to stay home and get care, and reducing those geographic barriers and travel times that can prevent people from getting the care they need.
That is good news for so many people. Thank you. I understand some specific drugs will have lower prices for Medicare beneficiaries this year. Andrew, which drugs will have negotiated prices in 2026?
Sure. Well, the complete list of 10 drugs is available online at cms.gov. And I won't go through the whole list of names because they're a bit of a tongue twister, as you can imagine, all those drug names. But they do cover a wide variety of common medications for arthritis, for cancer, for diabetes, and for blood clots. Again, many millions of people do take these prescription drugs each year, so it's possible you're already taking one or may need one in the future. And they chose the order by which they are negotiating drugs is based on how many people are taking it relative to how expensive it is. So they're going after the popular drugs that cost a lot of money first. And 2026 is the first 10. In 2027, there'll be like another 15 added to the list. And every year, there'll be more and more drugs added to that negotiated price list. So it'll save beneficiaries billions of dollars in the future.
That's amazing. How will these negotiated prices affect beneficiaries?
Sure. It's great because everybody will see them through lower co-payments at the pharmacy. So every time you go in to pick up your drug, the co-pay amount you'll be paying at the counter will be less because the overall price is less. Also, if the overall price of drugs comes down, then that factors into how premiums are calculated. So monthly premiums increases will be mitigated and might not go up as much. And again, this applies to all Part D plans offering these drugs. And also, hopefully, the more people that are able to afford their medications can stick with taking them for a longer period of time, which will hopefully help people live healthier lives, which will reduce costs across the board. So this is a big deal for pocketbooks for everybody.
Thank you, Andrew. Last year, people with a Medicare prescription drug plan, including Medicare Advantage plans with prescription drug coverage, had the option to spread their prescription drug costs throughout the year instead of paying them all at once. What changes are coming to the Medicare prescription payment plan? Xavier?
Yes, so for those who were enrolled last year, don't worry, you are still enrolled in 2026, so you don't have to worry about that. And the cost did go up slightly to $2,100 versus the $2,000 from last year, and it allows spreading the prescription costs over the year. There is a nice little formula that they created to figure out how that spread will look out throughout the entire calendar year. But this really reduces upfront financial burden for high-cost medications and allow more financial freedom for those who need the assistance.
What a great way to help beneficiaries really manage the costs they do incur. Just a quick reminder to our listeners, if you would like to ask a Medicare-related question, press star 3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. Now, we want to pause and take a moment to talk about what's happening in Washington and how AARP is fighting to protect your Medicare. Joining us is longtime AARP volunteer Ken Thomas from Florida. Ken has served in many volunteer roles, including driver safety instructor, Speakers Bureau, and AARP Florida State President. Ken, welcome.
Thanks, Natalie. Glad to be here.
Today we're talking about Medicare. What is AARP doing to protect older Americans?
Well, AARP is working hard to keep Medicare strong for both today's retirees as well as future generations. We're pushing for safer, more affordable care while cracking down on waste and fraud to make sure your benefits stay reliable.
Now, I've heard concerns about Medicare Advantage and changes to Medicare. So what's going on there?
That's a great question. When it comes to Medicare, AARP's mission is simple. Ensure that it works for everyone, whether you're in traditional Medicare or in a Medicare Advantage plan. That means protecting access to care and keeping the program strong for the long term. We've also raised concerns about proposals that could bring prior authorization into original Medicare, because that could mean delays in getting needed treatment. And we're also pushing for stronger consumer protections in Medicare Advantage to make sure people get the coverage they signed up for.
And that's important. What about prescription drugs? Many listeners struggle with costs.
Absolutely. And as you heard a few minutes ago, for the first time, Medicare can now negotiate prices for certain high-cost drugs. And there's a new out-of-pocket cap in Part D that gives seniors more predictability, which is important. Those are meaningful steps forward. And at the same time, some drugs still start at a very high price or increase over time, and shortages can disrupt care. That's why AARP is working to strengthen the drug supply chain and improve transparency so older adults can count on affordable medications and reliable access when they need them.
What can listeners do to help?
Well, first and most importantly is speak up. You can call or email your lawmakers and let them know Medicare and prescription costs matter to you. You can also volunteer with AARP in your community. It's such a rewarding way to give back and stay connected. And if you want to stay informed, go to aarp.org/getinvolved and sign up for our free advocacy newsletter.
That's aarp.org/getinvolved. Ken, thank you so much for being here and for all you do.
Thank you, Natalie. It's an honor to stand up for our seniors.
Listeners, we are back to taking your questions. Julio, let's take a call.
Yes, our next caller is Elizabeth from Oregon.
Hi, Elizabeth, out there in Oregon. What is your question?
Hello. I turned 65 several months ago, and I did not join Medicare at the time because my husband was working. And now I'm thinking, well, Medicare is a really good thing, and I would really actually rather be on Medicare. And so I'd like to know if there's a way that I can still join Medicare, and also can I join if I still have insurance, or do I have to wait till the insurance stops that my husband has?
Great question, Elizabeth. Xavier?
So this is going to be a long answer for you, Elizabeth. And so you are totally fine staying on your husband's insurance if his employer is a larger employer. And so if it's like a small employer, like 20 and less, then you have to sign up for Medicare when you're first eligible. If it's larger, then you're fine. So what a lot of people do is they do a hybrid approach to when they're in this situation. We know Part A is free, and so they'll elect to go ahead and enroll into Part A, and then they'll delay their Part B enrollment until they lose that coverage through their employer. And it seems like for you want to sign up now. So if you would like to, you can elect to no longer be covered by your spouse, and then you can enroll, and that would start you with a special enrollment period for your Medicare coverage to begin. If you want to do both coverage, which it sounds like could also be an option for you, then you would have to wait if you're outside of your open enrollment period, which is 3 months before your 65th birthday, the month of your 65th birthday, and then 3 months after. If you're outside of that 7-month period, then you can wait until the general enrollment period, which, lucky for you, is still going on right now because it's January through March. You can go ahead and sign up for Original Medicare. I know that was a lot I just threw at you. And so, but yeah, you have options, and you're in the correct period of time to get things done if you want to do something.
Thank you for that, Xavier. Julio, do we have another one?
Yes, we do have another caller on the line, Kate from New Hampshire.
Hi, Kate in New Hampshire. What is your question for us?
Good afternoon. This is a question of something you spoke of earlier, the IRMA, and I'd like to explain to the audience. It may be interesting and helpful for them. We didn't understand this impact and whether there may have been things. I'd love to know what we could have done to, as you know, sooner than we're sort of stumbling into what's the right thing to do. But it's 2026, and in 2004 we sold our home. So in 25, the home sale money came and went, and so in 2026, our income is nothing. You know, it was a huge tax year in 2024. So the deduction or because of our income in that year, our Medicare premiums are very high. So then in 2026 now, our Social Security checks are very low, and we really aren't in that income bracket. And if you could help me understand, and also if there are things that people are anticipating selling a home, what they need to do. I think is there a way to address what our current income is and get help where the premiums are adjusted, but that's not the income we're at.
Thank you for that, Kate, about your correcting your income determination. Andrew?
Yes, no, that's a tough situation to be in. There is a way to appeal that determination and say, hey, that may have been my income in 2024, but that's not my income now. There are certain circumstances for which you can get like an exemption and recalculated premium. And you can do that by contacting the Social Security Administration. You can visit them online at ssa.gov. The form you're going to look for is called SSA 44 or SSA-44, and that is the Medicare IRMA appeal form, basically, and you can fill that out. But you got to provide documentation that, in your case, the sale happened in 2024. It is not continued income. Your 2025 tax returns, and if you've already done your 2026, or you filed this year and last year, that will reflect a different income amount than when you filed for 2024. You'll have to provide documentation for that, and they should be able to consider that. I will say, though, even if the Social Security Administration does not change your premium, this only impacts this year. It is not a forever thing. They recalculate it every year. So as soon as that next tax return gets looked at, so the 2025 returns, which you may be filing now, they will recalculate your Medicare premiums for 2027. So it shouldn't show up next year. I know that's cold comfort sometimes, but this is not a forever determination. And so every year they make a new decision.
Really great questions from our callers. And we'll get right back to more of your live questions. But first, Xavier, I have a question for you. I understand that those that have chosen to enroll a Medicare Advantage plan can now confirm whether a preferred provider is part of that plan. Can you elaborate?
Yes, for those considering a Medicare Advantage plan, either during their initial enrollment or during open enrollment in 2025, the 2026 Medicare Plan Finder included it for the first time, and information about which doctors and other providers are included in the Medicare Advantage Plan network. This meant consumers didn't have to leave the Plan Finder to see if their doctors or hospitals and other clinicians were included in the insurance provider's network. It helps ensure that access to preferred doctors and services. That being said, the provider directory was being updated with the latest information as CMS received it. So it was ongoing and updating throughout open enrollment.
Does that mean you may not have seen a provider listed in if CMS hadn't received the info when you did your research?
It may. And so if that applies to you, CMS will allow a special enrollment opportunity. So if it applies, if the provider network information was inaccurate. So you can contact 1-800-MEDICARE and also shiphelp.org in order to make those changes that you need to.
Excellent information. Thank you. Let's get back to our listeners' questions. Julio, who do we have on the line?
Our next question comes from Teddy on Facebook, and Teddy asks, I didn't realize there was a penalty for not enrolling in Part D when I initially enrolled in Medicare. I enrolled 6 months later and have been paying the penalty for 10 years. Why is the penalty for life?
That's a great question, Teddy, on Facebook. Andrew?
That is a good question, and unfortunately, it's probably not a very satisfactory answer. The Medicare premiums, both for Part B and Part D, there is a penalty if you enroll late. Their penalties are different, though. In Part D, the drug plan, it's for every month you delay enrollment. I believe it's 1% additional, so 6 months is about 6%. In Part B, for every 12-month period you delay enrollment, there's 10%. So if you delay enrollment for like 2 months, it won't matter, but if you delay enrollment for 2 years, it's a 20% penalty. And the intent of the penalties is to encourage people to enroll in insurance when they're first eligible. The fear was that if people can wait until they get sick to enroll in coverage, then everybody will wait, and then Medicare will just be full of people that are sick and costly, and the program won't be able to survive without healthier people enrolled. So this was created as a way to entice and incentivize and encourage people to enroll as early as possible. And I will say that AARP has endorsed legislation to change the penalty structure, to put a duration limit on it and a financial limit on it, because we do think that it is a bit unnecessary to have a lifetime penalty, especially considering it's a percentage base and not a flat rate base. So the costs keep getting more and more over time. So it is something we're working on. It is difficult getting this through Congress because it will have a cost to it and a trade-off. But we think it's important for beneficiaries to be treated fairly no matter when they enroll. So it's something we're mindful of, and we thank you for sharing that with us.
All right. Julio, another one?
Our next caller is Leslie from Pennsylvania.
Hi, Leslie in Pennsylvania. What is your question for us?
My question is about a food card that they have to be advertised on TV. And the one thing is finding out if the card is legitimate, and if it is it based on income?
Thank you for that question, Xavier.
So some Medicare Advantage plans may have food assistance. With that being said, that is specific to that particular Medicare Advantage plan. And so if you have any questions on what your plan and what it will cover, then look at your plan details. And that is where you should look at first, not the commercials. Look at your plan information to see what is being covered by your plan to see if you qualify for one of those type of programs.
All right.
Our next question, is Jay from Facebook, and Jay asks, as you get older and forget things, how do you prevent problems of missed payments or inability to pay?
That's a great question out there in Facebook, Jay. Andrew?
That is a good question, and it's unfortunately a difficult one to answer because, of course, every situation is different. With regards to Medicare, like payments and premiums, typically most premiums are deducted automatically from your Social Security benefit for Part B. Part D and Medicare Advantage plans, you might have to submit a separate payment on your own, unless they offer like some sort of direct deposit or automatic withdrawal or automatic billing system. You would probably have to write a check every month. How you remind yourself to do that, I don't know. Some good strategies are, again, work with a financial planner to have an automatic billing system set up. We care very much about family caregivers, and we recognize that many people, really rely on a loved one or a neighbor or a child or a spouse to help with these healthcare routine tasks and decision making. So it's definitely something to talk about with your family and with other people. You shouldn't have to make these decisions by yourself. We encourage you not to make them by yourself. AARP can offer support and resources for family caregivers to help guide those difficult conversations as people age. So this is a very good question, but every answer is going to depend on the individual and the family for how to navigate some of these tough choices.
All right. Julio?
Yes, our next caller is Laura from New York.
Hi, Laura from New York. What is your question?
Yeah, hi. I just wanted to ask if you can get Medigap coverage if you're on Medicare Advantage.
No, you cannot have both a Medigap and a Medicare Advantage plan at the same time.
All right. Do we have another question?
Yes, we do. Our next question is Marlu on Facebook. Marlu asks, I will be 65 in May 2026. I don't have Medicare yet. I'm still under my husband's health insurance. Can I delay Medicare? I'm not collecting Social Security yet. I'm bombarded with information in the mail. What is the first step for me?
That is a great question, Mary Lou. Andrew?
Yes, this is similar to another caller's question. If you're under your spouse's health insurance, then you can delay Medicare enrollment. Although we would suggest thinking about whether you want to enroll in Medicare Part A first, because that is typically premium free. You don't have to pay anything for that to be enrolled. So you have that kind of as a backup. And then when you decide to enroll in Medicare, or when your spouse or partner retires and no longer has employer-sponsored coverage, you will get what's called a special enrollment period in which you can then enroll in Medicare without penalty. So as long as the employer basically says it's okay to stay on their coverage, it's okay to stay on their coverage after turning 65.
All right, I think we have time for one more question.
Yes, we do. Our live caller question is Charlie from California.
All right, Charlie, out there in California, what is your question?
I'm sorry, this is very similar to the last question. I also will be turning 65 in May, and my wife is in the has insurance, and with the school district, and I just wanted to know if I needed to go ahead and have Medicare. It sounds like you just answered the question the last time, though.
Well, doesn't hurt to hear it again. Xavier?
Okay.
Yeah, so as you mentioned, this is a very similar question. And so what I'll do is tell you about the timeline of when you have for your initial enrollment once again. And so when you first become eligible at the age of 65, or if it's your 25th month receiving SSDI payment due to a disability, you have a 7-month period of when you can enroll. You have 3 months before your birth month, and 3 months after your birth month in order to sign up for Medicare. If you miss that period of time, then you have the general enrollment period, which is January through March. So for those who have missed your general enrollment period, we are still in March, so go ahead and sign up for it now.
That's great advice. Now, we've covered a lot, so let's go over some of the key takeaways. Andrew, why don't you start?
Happy to. Yeah, there's been a lot of information today. But I think the important thing to remember for everybody is that Medicare is affordable and comprehensive coverage, but it is not free. There are some costs like premiums, coinsurance, and deductibles. And if you're having trouble paying for health care, help is available through your state Medicaid office and those Medicare Medicare savings programs available in your state.
And Xavier, what would you add?
Remember that if you enroll into the prescription payment plan last year, that you're automatically enrolled for this year, and it's not too late to sign up. And also that the end of March is the last day to use the special enrollment period for those who signed up for a Medicare Advantage plan and got incorrect provider information. And go to AARP.org to get the latest Medicare information.
This has been an informative discussion. Andrew and Xavier, thank you for sharing such great information and answering questions from AARP members. On behalf of AARP, thank you to our listeners for participating in today's call. We hope you learned something new today. Have a great rest of your day. This concludes our call.